Search for water and pasture takes precedence in a pastoralist's life at the expense of other considerations like access to health services. In Lodwar, expectant mothers and children suffer most since each migration translates to moving away from health services.
We have children out in the nomadic pastoralists who have stayed since their life, they were born up to 11 years without getting any immunization. If we don't visit them, that means they will stay like that without visiting any health facilities because their first priority is the livestock and not that medicine and not that vaccine.
The health concerns of nomadic pastoralists are at the heart of the Catholic Diocese of Lodwar. Infrastructure is virtually non-existent. Accessibility to the settlement areas remains a big challenge, especially at times of rains. Nevertheless, the diocese literally continues to take health services to them wherever they are on a monthly basis through mobile clinics. Cordaid and other partners' invaluable support in terms of medical supplies and staff remuneration have ensured that the Turkana community has access to health services. The outreach visits entail health education and other various health services. Expectant mothers also benefit from prevention of mother-to-child transmission of HIV services. But a big challenge is gradually complicating further this marginalized health situation. HIV and TB cases are on the rise, with HIV prevalence and infection rate reported at 13%. Denial and stigma are rife, with the service providers rating it at 95%. To effectively address the situation, the diocese has opted for community-based TB and HIV management approach.
Home-based care is essential to us in that it's the foundation or it's the basic to cut off some costs for admissions and for somebody having been too much sick because the use of locally available resources.
Home-based care has helped ease congestion at the only diocese referral hospital, Kakuma Mission Hospital, 95 kilometers away from Lodwar town. Addressing the HIV situation is a shared responsibility by both the laity and the religious. Sister Jacinta reaches out to a section of the possible 17,000 persons living with HIV/AIDS, giving them psychosocial and spiritual support.
Kusaidia amenisaidia muda. Tangu niliingia kwa hapo, tangu hali yangu ilijulikana, amenisaidia muda. Na hata nguvu yangu yote nilipata kwa hali yake, kwa vile nilienda msaidizi kwake.
Adherence to drugs or even their intake becomes a challenge to them at times of drought, since they lack food. As such, Sister, through Cordaid and other well-wishers, purchases food supplements, which she distributes to them once every month. Janet. HIV as well as gender issues are important in the planning and implementation of drought mitigation and preparedness programs.
Since the establishment of the policy, there has been a focused way of designing involving both gender to have concerns of both men and women taken into the program design and implementation. At the same time, be able to reduce vulnerability of both men and women in as far as drought is concerned.
The Catholic Diocese of Ngong, a long-term partner to Cordaid, have since developed a gender and HIV policy.
This HIV/AIDS policy has really helped to integrate and harmonize the various interventions on HIV We can see a lot of confidence among our program implementers in the field, in the parishes, and guided by the guidelines of the policy document, we are able to know really and make priority areas on what we want to do.
Through teamwork, they carried out a gender audit with expertise support from Cordaid's capacity building partner, International Institute of Rural Reconstruction. The impact of the policy is beyond drought interventions. Experiences from the implementation of the policy have seen the diocese also develop other policy documents. Cordaid finds inspiration in the achievements attained through the Drought Cycle Management and Disaster Risk Reduction model.
What we have done so far with the communities is not adequate. The DCM approach is workable, it's working in the field. The fact that the partners themselves participated in the writing of the Drought Cycle Management Toolkit and they have got the opportunities to apply the same in the field, it's been a very fulfilling experience for us, both with the partners and the community.
In great lengths, the Kenya Drought Cycle Management Program has reduced communities' vulnerability to drought, but still there is more to be done.
Our strategy is continuous fundraising also to be able to do and accommodate more of these requests. We appreciate the funds that has been available so far, and ECHO have also gone to great lengths in supporting our regional drought preparedness program both in Kenya and in Ethiopia. And currently we are also discussing more funding opportunities in the same area and for drought management initiatives in a greater Horn of Africa.
Cordaid is a learning organization. Lessons learned from implementing the Kenya Drought Cycle Management Program are bound to shape her future.